Doctor, let's zero in on Robin Hood this particular time. What could have been done to save him? I mean, he's here, he's collapsed, he's on the floor, and there's pandemonium in that particular office. What do you think would have been done to save his life?
Yeah, I'll first of all want to discountenance the fact that the story was situated in the context of a dream for the sake of millions of Robin Hoods out there. So it's critical we move on from this point as though it has happened and something needs to be done. So this is a classical case of a cardiac arrest, and oftentimes when in the lay literature, this is described as someone has collapsed or someone has fainted. I want to emphasize that the chances of survival of someone that has collapsed, or a person who has developed cardiac arrest just means a situation in which the heart ceases to beat, and there are several conditions that could lead to that. There are so many conditions that can result in that, but it's a condition that everybody should be familiar with, whether professional or lay, and more importantly for the lay public, because it's been shown that the outcomes for persons who would survive cardiac arrest depends so much on what the immediate responders do. Yeah. And immediate responders are typically the non-professionals who are there. As we can all recall from basic elementary school, those days they talked about the ABC of resuscitation in the Red Cross Society, Boys Brigade, and stuff like that. But it's still the same basic principles. But there have been some modifications here and there as a consequence of better evidence, so that we can improve outcome. But the important thing is the concept of what is known by the collective majority. What people will do in any situation reflects what they know. And if you are in a culture where when people collapse, they start running out looking for milk, or looking for all kinds of more drinks, or looking for water to pour on, even rescuers that know what they are doing, and the victim, it reflects head knowledge. And this is where programs like yours would go a long way in changing our perspective and our attitudes and what we will do in such situations. We have to take this as a classical case of a cardiac arrest with lay rescuers around. The lay rescuers have to know what they should do. But the question is, how do they know the right thing to do? The only way they can know the right thing to do is if, as an organization where he works, where he worked, if they had invested in the safety of their workers. Yeah. And also bringing into perspective the fact that in offices and places where you're going to have more collection of people, usually once you're going to have more than 10 people gathering somewhere, there should be provisions for emergencies or situations like this. Now, the first thing, it's interesting that there are so many people there. But notably, they were talking about his belt and his shoes. Interestingly, in the context of the cardiac arrest, and those are your list, they are the list of your concerns. The first thing is the man was already on the ground, a hard floor. That's a perfect surface for resuscitating someone that has collapsed. I overheard some people calling and shouting, "Robin, Robin." Yeah, you check for response. Okay. And if there is no response, I want to assume that being an office, that it's a safe environment. Right. So if he has collapsed in a position that that is considered safe for resuscitation, the people around should have to begin resuscitating him. Now,
sorry, I'm going to cut you, Doctor. When you say a position that is safe for resuscitation, what exactly are you looking for?
Good.
In terms of the ambulance?
Yeah. A lot of your listeners and viewers out there may encounter similar situations.
That's right.
And may be inspired by what you are doing to want to acquire better training, more knowledge about how to respond when people collapse. But the first thing you should actually do is to assess the safety of the scene.
Okay.
There have been instances in which people attempted to resuscitate victims without paying attention to the safety of the scene.
Environment. I see.
And we ended up having more victims.
Wow.
And outright casualties.
Wow.
So it's important that whoever is going to work on that, assess the situation. So you won't say Robin has collapsed by his desk and you are going down on a naked electric cable.
Okay.
That is a possibility in an office scenario.
Wow.
So instantly, the first thing is assess the scene. Once the scene, you've confirmed that the scene is safe to approach. This is a non-technical thing.
Yeah.
If the scene is safe to approach, you can move closer. I overheard them calling Robin. That's also important. You call to see if the person will respond. If the person does not give any response, it tells you that the most likely are in cardiac arrest. The next step to take is to activate the emergency medical service. In most people be familiar with 911 because of so much influence of Western movies. But interestingly, in Lagos, it's 767, and if you can try this on your phone, I'm sure they're going to respond to you right away. In Lagos, it's 767. You activate the emergency medical service and tell them what has happened, where it has happened, and what time it has happened. Okay. In some scenarios, they are going to give you a guide on what other steps to take. But in coning down on that scenario involving robbing an office environment, I expect that they shouldn't crowd around him as usual, like most people would do in emergency situations. Further, depriving him of fresh air. So crowding around victims is never helpful. You deprive them of fresh air, you worsen their condition, and you hasten their demise. So I expect that being an educated population, they should do things in an orderly way, get him to safety, make sure there are no cables, no electrical devices that could further hurt him or hurt people that are trying to rescue him.
All right, doctor, you were talking about pulse examining the patient.
They should feel his wrist. They should feel for his wrist pulse, and if there is no pulse, that's another confirmation that is certainly in cardiac arrest. Because if you called him, he's not responding. You've looked at his chest, he's not breathing. You've checked his pulse, there is no pulse. Instantly, you have to start resuscitating it.
Sorry, I'm going to cut you again. When you talk about pulse, we're taking this from a totally layman's perspective. How do you check someone's pulse as a layman? Before we move on, again, I in an office setting, because I was going to come to this much later, but I think it's important we bring it up now. The moment you call for the emergency response, there is a device called the AED, or the automated external defibrillator. You should send someone to go and get the defibrillator. It is assumed that
it is assumed that it is yes, because that's where I left it up, because I know in most settings in this country you won't have that in the office. And it's important we bring it up now so that listeners can understand why it's important for organizations to acquire one and have one at hand, because that will even encourage people to acquire training in its use and acquire training as first responders generally. So as you are activating the emergency medical service, that's 767 in Lagos, you are also sending somebody to go and get the AED, assuming that there is one, and there should be one ideally, because they are not so expensive. Maybe something in the range of $1,000 to $1,500, you can have one. Now, back to the person you've called in is not responding. You've activated emergency services. You've sent someone to get you an AED. You've checked there is is not breathing, or sometimes the person may just be they may be gasping. Gasping is not normal breathing, so they may be breathing with their mouth open, lifting up their head, showing that they are in some form of agony. And so when you find victims that are gasping, that is not normal breathing. It's still a sign of cardiac arrest. And checking for the pulse. For non-professionals, the wrist pulse is advised. If you feel along the outer border of the wrist,
okay, just
like you turn the patient's palm, you follow the thumb back to the forearm at the wrist itself, where the base of the thumb meets the wrist. There is a little depression. At that point, you should feel. You can try that on yourself. Can you feel it? Yeah. If you put 2 fingers on that point, you feel the
point, yeah.
Yes, you feel the person. You feel your pulse. That's the radial pulse or the wrist pulse. So if you feel the wrist pulse, it means the heart is beating. But for somebody that has collapsed in a setting where you are talking about first responder that are late, it still does not imply that the person should not be resuscitated. So, but generally, as an acronym, we should know that the key thing now is chest compressions, airway, and breathing, then defibrillation. So for non-professional, non-healthcare providers that are the first responders, you've found that there is no pulse. That means you have to start chest compressions. The key thing in
when you say chest compressions,
now for chest compressions, you put the heel of one hand over the lower 1/3 of the person's chest, of the person's breastbone in the center of the chest. Now you put the other hand inside on top of the first hand. You spread the fingers of the first hand and allow the fingers of the second hand to move into the web spaces. Now you lock the upper hand on top of the lower one. So you have a firm grip that way, and you start depressing. So as you press, you push hard and fast. You do 30 compressions in 1 minute to every two breaths. Now I will still talk about how you give the breaths later.
I was going to ask that.
So as you push back, because the essence of the chest compression is to squeeze on the heart, and in between, as you push down, you release the wrist, the lower wrist a little, so that the chest can come up. So as you are doing that, and the chest and coming up, you do that fast. You do 30 of that, then you give 2 breaths. Now, how you give the breaths? Ideally, in the workplace too, there should be a mask, a small mask device that you can use. But if that is not available,
that's different from a nebulizer, is it?
No, it is certainly different. You don't need any equipment for this. Okay. This is just basic. This is just a basic face mask. The essence of the face mask is to protect the rescuer, not so much about the victim. But in the absence of that, you can do mouth-to-nose resuscitation. So you push the patient's head up so that you can extend the neck gently. Then you breathe breathe for the patient through the nose. As you are doing that, you should see the chest rising.
All right.
So if the chest rises, it shows that the air you delivered went straight down into the lungs. So you give 2 of that, then you continue with the chest compression. Or you do about 5 cycles of 30 to 2 until the defibrillator arrives. Now, if the defibrillator arrives before you've completed 5 cycles, you can quickly follow the steps for the defibrillation. If defibrillator has not arrived, you do the 30 to 2 compression and breathing. 5 cycles. After completing 5 cycles, check the pulse again. In older teachings, it was like you do one, you check the pulse and see if the person is responding. And the newer guidelines, you do that, you do 5 cycles before you check for pulse. So you keep doing 5 cycles, you check for pulse, 5 cycles, you check for pulse, until pulse has come back and the person is breathing, the victim is not breathing on their own, in which you just put the victim in a position we call the recovery position. that is a position the patient lies on the side. You turn their head down, their head not facing down, but the head on the side, so that if there are secretions in the mouth, it can flow out. So the patient will be maintained in that position until emergency medical services personnel arrive. But if the patient does not recover, and while doing the CPR, a defibrillator, an automated external defibrillator, which is what the non-professional care professionals can be trained to use. The defibrillator is a simple machine.
I was just going to ask you that question.
It's a simple machine that is designed to deliver a shock to the heart, because we know that in cardiac arrest, it's not as if the heart has stopped completely.
Okay.
The heart is actually still working, but the electrical activities in the heart are not well coordinated, so that the heart muscle is not able to contract as a unit and pump out blood that can go around the body and deliver and get to the lung, get oxygenated in the lung and take oxygen around the body. So in that situation, we know that if you deliver a shock to the heart, that shock stuns the electrical apparatus in the heart, and out of that, as the electrical apparatus is surprised, is stunned, it stops temporarily, then picks up. So we know that when it's picking up, it picks up in a better way, such that the activities are more coordinated, goes around the muscle, and the heart muscle starts pumping shortly after. So that is the essence of a defibrillator. Now, the automated defibrillator has been designed for use by non-professionals, and once the defibrillator has arrived, you push on the button, you push the power button, and from that point, it tells you what to do. You have to apply the pads on the left and right parts on the respective parts of the chest. It's voice prompted. It's safe to use. It's well designed. It can be used by, even children have been known to use AEDs to resuscitate adults.
Wow. In
advanced countries. Children as young as 8 can make use of AED, because think of it, the AEDs are much simpler to operate than high parts.
Wow.
So and we have children as young as 7 operating iPads properly. So it's not surprising that children can operate AEDs voice prompted. Once the pads are applied, the AED examines the heart, and it will assess whether it's a rhythm, if the electrical activity in the heart, which we call rhythm, if it's a type that needs a shock for the heart to get back.
Analyze and tell. So
while it is examining the heart, the voice prompt tells you that, and it tells you that the AED is analyzing. Okay. Actually, I didn't want to go technical. So as it's telling that the machine is analyzing the heart, immediately it tells you if it's a type that it can deliver a shock. So if it's a type that it can deliver a shock, it tells you to move away from the patient. And there are some that you have to push a shock button, and there are some that the shock will be delivered by the machine. So once the shock is delivered, it tells you shock delivered, continue resuscitation. Then you continue the chest compressions, very important. Wrist, the heel of the hand placed over the lower 1/3 of the breastbone. The upper hand, the fingers locked deep between the webs, and you deliver compressions 30. You depress about you push in about 5 centimeters. Then you allow the chest to.
You just determine this arbitrarily.
These are guidelines, and that's why talking about this is not as important as a society and as a people. For us to appreciate safety, for us to appreciate emergencies, for us to appreciate that situations like this will always occur in our communities, in our workplaces. People have to be trained to deliver these things. We need to understand that training is important. People have to be trained so that they can function effectively as first responders. Because in as much as we know that people that would have some of these conditions would have had premonitory signs or symptoms, it's not always that happens. There are situations in which apparently healthy people apparently healthy persons would develop cardiac arrest, and you can't tell who's going to be next. So it's important that as a society we invest in having high quality first responders, and this goes all the way from educational content, the content of movies that we expose our children to, and so it's something that everybody should be involved in, religious organization, but getting the right kind of training. Because you can imagine, I mean, that was an office. Things like this happen even in places of worship. Things like this happen. People collapse, and before you know it, they tell you they rush the person to the hospital. They couldn't, before they got the place, they could get the man admitted into, the man had passed on. But the quality of the first response is very, very important. They are simple things, but certainly there are things that people would learn to do properly if exposed to proper training. So it's important that people listen to cues from their bodies, because in many cases your body would have been warning you that there is something wrong. It could be unusually aware of your heartbeat, which we call palpitations. We talked about chest pain, we talked about shortness of breath. We talked about easy fatigability, that is getting tired more easily than usual. We talked about lightheadedness or feeling faint. So these are all signs that the heart may not be functioning optimally, and there are signs that you don't even need a collection or a constellation of these signs or symptoms before you go to your doctor. There is no harm in seeing your doctor for an unusual chest pain and undergoing proper evaluation of the chest pain, and if at the end of the day they find out that it's just from the chest muscles, that's still okay, but at least you're sure you've done what you were supposed to do. So looking after work doesn't help anyone. It doesn't help anyone. It doesn't add to the quality of your life. It shortens the lifespan, and we have scenarios like this. But having a cardiac arrest is not enough reason to die, because beyond that, it could arise in settings in which there may not have been any premonitory sign, and everything will boil down to what the first responders do. What the first responders do can make all the difference. So it's important for us to ensure that the non-professional, the non-technical aspects of emergency management as a society, we pay attention to this via content of education curricula from primary to secondary education, from primary to secondary levels, even at tertiary levels, ensuring that people undergo proper training and drills. NGOs can come into this, ensure that people have proper training, so that when situations like this happen, they don't crowd around the person, they don't start pouring water on them, so they know the basic important things to do. Calling the emergency response if there is AED getting one, knowing what the proper positioning for the victim. So these are all, they are little things, they are very important, but they have to come with education, training, and enhance societal awareness.
All right, thank you very much. We've been having wonderful talks with Dr. Idris Oladipo with respect to the classic case of Robin Hood, a classic case of cardiac arrest. Ladies and gentlemen, I am proud to announce to you that courtesy of Dr. Idris Oladipo, we're going to have on our website, that's www.flatline.com.ng. We're going to have on our website a BLS tutorial, a basic life support tutorial for lay persons, okay? And he's promised to do that for us, and we want you to be able to go to that website and download it. Some of the things that he has talked about, if you're listening on radio, you may not be able to see those things that he's talking about because you're listening via radio, but if you do get on our website, you will find a tutorial there that talks about these things, and you will be able to download. We'll make it in downloadable form that you can download and watch over and over again, so you will know how to help anyone as a first responder in such a situation like this. Dr. Idris, I'd like to say a big thank you to you once again. It is our custom on Flatline to always ask our wonderful guests about their favorite song. They say all work and no play makes the apple dull boy. So we're going to ask you, Dr. Idris, what's your favorite song?
Okay, for today, Bob Marley, One Love.
Wow, that's a wonderful song, ladies and gentlemen. It's official. Dr. Idris Oladipo loves Bob Marley, and he wants us to have one love. One love keeps us together. One love keeps our hearts together. When our hearts are together, we are together. What a wonderful song, what a wonderful person, and what a way to round up. This is Flatline. Remember, be safe, be healthy, prevent the flatline, listen to Flatline. Thank you very much.